The next session is going to be very important. There is one subject जो हम सब लोग कमजोर हैं. एक तो हम सब लोग कमजोर थे ईसीजी में, हम लोग कमजोर थे, बट अब नाउ धीरे धीरे हम ईसीजी पिकअप करते आ रहे हैं. दूसरा जो हमारा कमजोर सब्जेक्ट है वो होता था पैट स्कैन, सीटी स्कैन, एमआरआई, क्योंकि हमारे को एमबीबीएस में नहीं पढ़ाया जाता था. लेकिन अब धीरे धीरे हम लोगों ने सीख लिया. सबसे जो हमारा कमजोर सब्जेक्ट है वो है न्यूक्लियर मेडिसिन इन मॉडर्न प्रैक्टिस, इंटरप्रिटेशन ऑफ न्यूक्लियर मेडिसिन. रोज बोलते हैं स्कैन करा लो, हम लोगों को बोलते हैं स्कैन करा लो, थायराइड स्कैन करा लो, रीनल स्कैन करा लो, बोन स्कैन करा लो, कैंसर में जाके स्कैन करा लो. फिर हम डरते हैं लिखते हुए स्कैन कौन सा कराएं, तो हमें पता ही नहीं. विजय साइज स्कैन करा लो, इट्स लाइक लेबोरेटरी में भेजना ब्लड टेस्ट करा लो. सो वी थॉट ऑफ having an important session on nuclear medicine in modern practice. We have Dr. Awadhesh who is going to cover it. It will be a 15 minutes lecture, and the basic lecture will be on indications, contraindications, and understanding the concept of nuclear medicine. I present to you Dr. Awadhesh. Dr. Awadhesh has started a center in National Heart Institute. It's a new center, and all of you have got their pamphlet also. And this is the National Heart Institute has outsourced them to start a center in nuclear medicine, which we feel is the need of the day, because you cannot evaluate a patient of chronic kidney disease without getting a nuclear medicine study. You cannot differentiate between thyrotoxicosis and autoimmune thyroiditis, or between Hashimoto's disease without going through a nuclear scan. You cannot evaluate a patient for a need for bypass surgery without going through a nuclear medicine test. So you cannot go for a renal transplant without going through a nuclear medicine test. So this understanding is of utmost importance.
Good morning to all of you. Chilly morning today. We start with nuclear medicine in modern day practice. We started a nuclear medicine department inside the premises of National Heart Institute in east of Kailash. We are doing all nuclear medicine scans that are in vogue anywhere else in the world. Imaging as such can be categorized into three categories: anatomical, physiological, and biochemical imaging. Anatomical imaging modalities we all are aware about: X-rays, CT scan, MRI, ultrasound, angiograms are anatomical modalities of imaging. It is possible that anatomically the organ concerned might just look normal, physiologically it just might not be. Nuclear scans, PET scans are domains of physiological and biochemical imaging.
नहीं ये तो सर दो ही तो है इधर. अब तक कहाँ है सर? इसको बाहर लेके आएगा मिला है फिर नहीं चलेगा. नहीं अब तो पॉइंटर है. पॉइंटर चाहिए. ये जो है ना, ये और ये है तो लेजर पॉइंटर चाहिए. लेजर पॉइंटर
These days we talk about PET CT scans. PET CT. Excellent anatomy in the CT scan and excellent physiology in the PET scan. Starting with the thyroids, a T3, T4, TSH evaluation of the thyroid will will tell you whether it is hyper or hypothyroidism. What is the cause of hyper or hypothyroidism can be known on a nuclear scan of the thyroid. Like, for example, in this particular case, you see there is a cold nodule in the right lobe of the thyroid. Cold nodules are nodules where tracer is not taken up. Normally, cold nodules could be a hypermetabolic nodule or could be a malignant nodule. We do a nuclear scan to actually confirm or rule out malignancy. We did a system EB scan, and please appreciate, in the same nodule, you see there is increased metabolic activity, which means that this, with a almost 98 to 99% precision, we are dealing with a malignant nodule and not a benign nodule. FNACs at times could not, it might not tell you whether the nodule concerned contains malignant tissue or non-malignant tissue. On a scan, it could be very clear. This is a residual thyroid post-surgery which needs to be radioiodine ablated. We did a system EB scan, and apart from the residual thyroid, there are many malignant nodes that are present. We did radioiodine ablation, and all the nodes are gone now. So what we do is, in a thyroid scan, if the patient can have a nodule which could be a toxic nodule, which could be a malignant nodule, which could be just a colloid goiter, all these things can be differentiated on a thyroid scan. The treatment of thyrotoxicosis as such is a clinical condition, could be produced by primary hyperthyroidism, that is Graves' disease, or thyroiditis. To actually differentiate, because subacute viral thyroiditis can take a long time to develop and stay with the patient. T3, T4, TSH, in all these conditions, T3, T4 will be raised and TSH will be lowered. On a thyroid scan, black and white, we can come to a conclusion whether this nodule, this thyroid gland that we are dealing with is primary hyperthyroidism or thyroiditis. In both the conditions, you can see, in cases of primary hyperthyroidism, you can see the thyroid gland very nicely. In cases of thyroiditis, you don't see the thyroid gland at all. In cases of inflammation of the thyroid gland, the tracer does not enter the thyroid gland at all. So that is how we come to a conclusion whether we are dealing with thyroiditis or primary hyperthyroidism. The parathyroids, the imaging modality for a parathyroid adenoma that could produce primary hyperparathyroidism is an isotope scan. People refer for an MRI. Now, usually an MRI will not be able to pick up a hyperparathyroid, parathyroid adenoma. An isotope scan can actually very easily pick up a parathyroid adenoma. Thank you. This is a parathyroid adenoma that is picked up. Initially, we used to do a thallium technetium subtraction scan for the parathyroids. But these days, we do a system EB scan of the parathyroid to actually pick up a parathyroid adenoma. Synty mammography. Mammography, conventional mammography, sonomammography can be done for a nodule in the breast. If there is high clinical suspicion and FNAC could be plus minus, in those conditions, we can do a synty mammography and confirm whether the nodule in the breast is harboring malignancy or no. A Meckel's diverticulum containing ectopic gastric mucosa can be seen very easily on an isotope scan, cannot be seen by any other modality.